Welcome back. You're watching Ozarks tonight. Good to have you along as always for the broadcast. I'm David Oliver. We have talked quite a bit over the last couple of months about how local nonprofits are still trying to do the important work that they're doing for our community amid this coronavirus pandemic. And we're going to talk to one such nonprofit agency today. We're joined by the CEO of Breast Cancer Foundation of the Ozarks, Joe Dawes, who you know because Joe is a Color 10 alumni. Joe, good to see you, my friend.
Thank you, and today you may call me Senor Dawes.
Yes,
happy Cinco de Mayo.
It is Cinco de Mayo, and we appreciate you stopping your celebration to talk to us. But on a serious note, Joe, let's remind our viewers first of all what Breast Cancer Foundation of the Ozarks is all about.
So, Breast Cancer Foundation of the Ozarks is a local not-for-profit organization started by Mary Beth O'Reilly 20 years ago. This is our 20th year, David, and the primary mission of BCFO is to help families going through a breast cancer diagnosis during treatment. So essentially what our mission is to fund non-medical life essentials during treatment. Things like rent, utilities, car payments, insurance, things like that. When someone is diagnosed with breast cancer and going through treatment, we work through the hospitals, through the doctors, and we bring them in. There's an application process, and then we pay their rent or utilities or whatever they need for a certain amount of time to help them get through those that serious time in their life. The second mission we have is providing free screening mammograms. Early detection is key for breast cancer. So not only do we help women that are already in that world, women and men, by the way, but we also want to make sure that we're helping people and families in the Ozarks find a diagnosis early. The earlier it's treated, the better chance of surviving and the better chance of effective treatment. So that's the other side of what we do.
And you know, Joe, we've talked a lot about here on our broadcast about other nonprofits that are still trying to do the important work that needs to get done. Just because we're in a coronavirus pandemic doesn't mean that breast cancer stops. And that's the same for you all and the efforts that you're making.
Yeah, in fact, the need's probably even greater right now, David, because we have the same number of women getting diagnosed. We have the same people in treatment, actually adding more every day. But this time of right now, what everybody's going through is a lot of people can't work. They can't be around people. Their spouses shouldn't be around people. I mean, think about this. If you're a working man and your wife is going through breast cancer treatment, you can't go to work and be around people and be at a risk for contracting COVID and then come home. You have to be extra cautious. So that means you're probably not working or working from home. Or if you're a single woman, then your diagnosis keeps you at home. So there's extra precautions, and the need is still great out there.
And Joe, you know, you've lived here forever. I've been here a long time. We know this is a very philanthropic community we live in, which means a lot of people have been supportive of BCFO over the years. Today specifically is Giving Tuesday, when people are being encouraged to give to nonprofits. What are you seeing in terms of that effort today?
Well, our effort goes on year long, David, and this is going to be a difficult year for all not-for-profits, us included, because we all do fundraisers, and that usually means a gathering of large numbers of people. So we don't know what that looks like for the rest of the year, and so we're all trying to work with health officials and our donors and supporters and our clients, people that we're helping, to try to make sure we do the most responsible thing. But Giving Tuesday, we're all out there on social media trying to make sure that people know what we do, who we help, and why local money that comes to BCFO stays local. I mean, this is truly a local not-for-profit helping local people. So it's part of our mission and one of the things that we do this time of year every year.
You know, Joe, one of the ways you all make money to help support the services that you offer to our community is through the contract you have with the state to run the local tag and license offices. I just saw you yesterday and we talked about this, the fact that those offices are now reopening. Talk about what that closure meant for your staff and for the community, and what kind of services folks can expect now. I'm guessing it's going to be a little bit busier there than normal.
It's been slightly busier, and we promised our people when we closed our offices on March 24th that we would not abandon them. So our 47-ish employees had to go home because we could not keep our offices open due to safety concerns. So we committed to paying their wage during the time we were closed, and then the CARES Act came through, and so that was able to help us do that. So we felt like we were a responsible employer in that way. BCFO manages 5 offices: Nixa, Ozark, Republic, Glenstone in Springfield, and then in Joplin. That money that we earn from those offices helps us pay our administrative fees. So when we ask for donations to help people in breast cancer treatment right now, we can tell you all that money goes to that to those people. So that's why we do what we do at the license offices. We decided to reopen them once the state said it was okay yesterday. And at several of our offices, we had 100 people waiting in line when they opened yesterday.
Wow.
So here's what's going to happen at the BCFO offices. We're trying to allow just a few people in at a time to keep a small group as we can in those offices. So what we're doing is we're taking your number at the door, asking you to please wait in your car where it's safe and you're not around other people. And then we call people on their cell phones, tell them to come in, we take care of their business, and then let them go and keep on going. So there are a couple things I'd like to mention, though, David, that are really important.
Okay.
Real ID, the federal Real ID in Missouri, that deadline's been extended for a full year. So if you need to come in and get your Real ID, you have until next October. Mm-hmm. So you can delay that for a while. The state also delayed and waived penalties, by the way, late fees, on most of its deadlines for 2 months. So you do not have to come in right away now that we've opened. And we're seeing huge lines in the beginning of the day. The afternoon, not so much. So think about when you're going to these license offices.
Yeah, we've done some reporting on those deadline extensions, Joe, here on the news on Color 10, and I think we should remind folks that they do have more time, because I think a lot of people probably did rush right out yesterday. We've got about 30 seconds left, Joe. Tell us how our viewers can help the mission of BCFO, and I know you have your website, which is bcfo.org.
Yeah, that's the easiest way. And, you know, we take donations. We love it when people post their stories on social media about how we've helped them. We've helped hundreds of families throughout the Ozarks. Come to our license offices. That helps us pay for our mission as well. But just the simple fact that this is such a giving community helps us all. So thanks for what you do, Ozarks. And David, thanks to you and all your crew over there. Tell them I said hi.
Well, I will do that, and it's fun to have you back on Color 10 here in this new capacity, Joe, and keep us posted on how things are going with Breast Cancer Foundation of the Ozarks, all right?
Arriba, as they say.
Happy Cinco de Mayo to you. All right, we'll have more.
Thank you.
Good to see you, Joe. More Ozarks tonight here on the broadcast after this quick break.